Can you see my screen?
Yes, we can.
Okay.
Yes, we can.
So good afternoon once again. I'm Akosua Pokua Adjei, a research assistant on the Meals for NCDs project. Meals for NCDs is a project that's providing measurement, evaluation, accountability, and leadership support for the prevention of non-communicable diseases. I'm also a master's student at the School of Public Health, University of Ghana. So my study is titled, How Healthy Are Our Supermarkets? Availability of Healthy and Discretionary Ultra-Processed Foods in Supermarkets of Selected Districts in Greater Accra Region, Ghana. So as we know, obesity is a major public health issue. Itself is a non-communicable disease. It also contributes to the development of other non-communicable diseases such as diabetes, hypertension, and other cancers. And intake of unhealthy foods is linked to the onset of obesity and diet-related non-communicable diseases. Availability of such unhealthy foods influences preference, choice, purchasing, and consumption of such foods. So this study determined the healthiness of food sold at supermarkets located in 6 districts in Greater Accra Region selected for the Meals for NCDs project. So my study is nested in a larger study, which is the Meals for NCDs project. So what we did was all supermarkets located within the 6 districts were eligible to participate in the study. And supermarket in my study is defined as retail outlets that had at least one staffed checkout area with well-defined aisles and was self-service operated. So in the supermarket, we measured the shelf length and breadth of all food products sold. We also took digital photographs of all the food products found in the supermarket. The foods were then grouped using the NOVA classification system and also grouped according to their nutrients and energy density. And so we classified food items as energy dense if the calories were greater than 225 kilocalories per 100 grams of that food product. And then we used descriptive analysis. Descriptive analysis was performed using Microsoft Excel and then SPSS to generate total areas occupied by the various food groups and also to determine the ratio of unhealthy to healthy foods. So our key findings are as follows. Of 103 supermarkets that we identified, 67 gave us permission. 85% of the shelf space occupied by food in all the supermarkets was allotted to unhealthy food categories. And we found refined grains and refined grain products such as biscuits, noodles, cookies to be the most available food groups, occupying an average of 577 meters squared, representing 15% of the total shelf space occupied by food. Fresh fruits occupied an average of 17 meters squared of the total shelf area, representing only 0.4%. Fresh vegetables and unsalted canned vegetables, on the other hand, occupied an average of 32 meters squared, also representing less than 1%. And so putting all together, the estimates showed that for every 1 meter squared of shelf area occupied by a healthy food, there was an average of 6 meters squared of shelf area occupied by an unhealthy food. Also using the NOVA, we found out that ultra-processed foods were the most available food groups within the supermarket, occupying almost 70% of the foods within the supermarket. And so our findings show that as supermarkets have risen in Ghana, they are offering access to healthy options such as whole foods, fruits, and vegetables, because we found them in the supermarket. But then they are making ultra-processed and obesogenic foods even more accessible. And as these foods are widely available, they are going to influence the risk of obesity and other nutrition-related non-communicable diseases. And so what we are recommending is that towards a healthier food environment, relevant stakeholders need to institute measures that improve availability of healthy foods within supermarkets. And also the government should ensure that authorities are well equipped with the requisite resources to monitor unhealthy foods sold in supermarkets. And so to conclude, this study reveals widespread availability of unhealthy ultra-processed foods in supermarkets found within the selected districts. As I end, I would like to acknowledge IDRC for funding the Meals for NCDs project. As I said, my study is nested in the Meals for NCDs project. IDRC stands for International Development Research Center, found in Canada. And Meals for NCDs is a partnership between 8 institutions that spans across Ghana, Kenya, France, the Netherlands, Toronto, and Belgium. Thank you all very much.